Hello, and welcome back to another episode of All Bodies, All Foods. I'm Sam, and I'm here with Ashley, and we're very lucky today to have our dance movement therapist here with us, Sara Earl. Welcome to the show.
Well, thank you for having me. I'm so excited to be here.
So, we would love to learn more about you. You work at Renfrew, you're a dance movement therapist, you've been helping out patients for so long now. What led you to Renfrew and the eating disorder field? And did you always know that you wanted to be a dance movement therapist?
Um, Such a good question. So I have to start back when I was 3 years old, and I had these really incredibly smart parents who enrolled me in a ballet class.
Mhm.
And it's a little bit like learning a language, if you learn French when you're little, you're really good at French. And so I think just by having those really early experiences, right, that language is just a part of who I am.
Yeah.
Um, and I think I had to like learn that I wanted to be a mover forever because, I was at a ballet company, and that probably tells you a lot right there about where some of my interests in eating disorders came from, right? Because I was
Mhm.
really subjected to a lot of those factors that can lead to an eating disorder. And so I kind of grew up in that culture. Um, and there's only so long really that you can do that before you kind of, age out of that kind of intense activity. And so when I got to college, I had to start thinking about what do I want to do for a living. And so of course, everybody's like, what can I do to make money? Right. And so I ended up actually going into visual communications. And I found myself like sitting at a computer all day long, really still.
Mm.
Right. And I just
Mhm.
remember thinking, how do people do this? Like, how do you sit still all day? Because I have all this in my body, right? This kind of languaging in my body that I'm not getting to use.
Yeah.
And so I remember at that point thinking, I need to go back to doing some movement. And I think when the spark really hit me was when I found a Nia class. And I don't know if you've ever heard of Nia, but
No.
it's a kind of holistic version of fitness, very mind body.
Oh.
Um,
Hmm.
and when my first teacher walked in the room, she walked in the room like a panther,
Really?
so in her body and
Yes.
so animalistic and sensual and just like owning it that I was like, oh, I want that.
Yeah.
And so
Yeah.
that's really when I decided that I'm going to be a mover. And so I taught Nia for a very long time. And as I was teaching and aging, my classes were becoming more and more therapeutic. I had people in the room that were cancer survivors and Parkinson's patients
Hmm.
and people with chronic pain. And so that kind of really led me to this place of dance movement therapy. And so then from there, I studied um, counseling and dance movement therapy. And my first job was down the road from Spring Lane. And I remember that I was in school and I was doing this internship and I was reading Susan Kleinman's writing. And
Yeah.
Susan is at Coconut Creek, and she's really the first one to really like marry dance movement therapy and eating disorders. And she's been our most prolific writer about it too, for a
Hmm.
long time. And so I've got, Susan Kleinman and Renfrew in the back of my head. And then I'm driving by Spring Lane every day on the way to work thinking, oh, there's that place, right? So it
Yeah.
was
Hmm.
like the magnet kept growing, every day. And so one day I just well, I'll go look at the job listings, and there it was. And the rest is history.
Wow.
That's
Wow.
awesome.
That's such a
Yeah,
cool story.
it's like
And
magic. Yeah.
I'm so curious to hear more about your experience in ballet. There are people listening who are probably thinking, wait, is being in ballet a risk factor for an eating disorder? And I think it surprises a lot of people that certain sports,
Yeah.
certain types of dance, especially any kind of sport with a lean aesthetic, any kind of
Mhm.
weight sensitive type activity, these can be risk factors. And
Mhm.
I would love to hear a little bit more about your experience. I mean, what a difference between being entrenched in ballet and then being involved with movement that's actually therapeutic
Yeah.
and helps you feel actually more connected to your body.
Yeah. It's so different now, than
Yeah.
when I first started ballet. I mean, I think that so many ballet teachers and so many dance teachers are really waking up to this idea that we don't all have to look the same
Yeah.
and that we
Mm-hmm.
don't have to look like that to be able to dance, that we all have
Hmm.
that ability to express how we feel in movement. And so I think there's even more of an attempt really for people to offer different kinds of techniques. I mean, ballet is still very much about the line and that there is a lot of pressure around body type, and I think that's why it is still connected to eating disorders. But also I think that the person who's in charge really has the ability to frame that differently.
Yes.
So, right?
Right.
Like you can,
Yes.
right? So there's a different way to talk about bodies and movement that wasn't possible when I was
Yeah.
doing. Yeah. Yeah.
Yeah. Sarah, what would, for any dance instructors out there, what would your guidance be
Yeah.
around switching that language?
Yes, we can change this,
Mm.
right? We all
Yeah.
have that inherent ability to move our bodies to rhythm in an expressive and artistic and pleasurable way, both, in terms of being the mover and being the observer, right? Like we can expand the
Hmm.
idea of what that looks like. Yeah.
Hmm.
Right. Right.
I love that because I think about folks in different sized bodies, and I'll speak to my own experience. I grew up going to magnet schools when I was younger, and so they like focus on different things, and the particular system that I went through was all arts magnet. So every year from fifth grade until my senior year, we would have 12 weeks of dance, 12 weeks of theater, 12 weeks of art, and things like that. And hearing that language shift, I've always kind of existed in a larger body. And so there were some times with some teachers that I didn't feel welcome necessarily, or like I couldn't, there were, those cute little like ballet skirts that you can wear with your leotard. Like sometimes I couldn't even wear those because they didn't, like fit my body. And so but then there were teachers that I could, and like there were teachers that were inclusive of all body shapes, and like anybody can move this direction and anybody can do this. And that like gave me so much freedom and like and really what's I guess like security, like, oh
Mm.
hey, I can get involved with this. It doesn't matter that my body doesn't look like some of my peers. I can still do this and have fun, you know?
Yeah.
Yeah.
Yeah, and there's like the essence of what, dance movement therapy does in the environment of an eating disorder
Yeah.
hospital too, right? Like
Yes.
that we don't all have to do it all the same way resonates in so many ways,
Yeah.
including how
Mhm.
we move through the world.
Yeah.
Right.
Sarah, so can you take us to the basics of what like dance movement therapy is and kind of also help us understand maybe what it's not and how it's related to exercise or not? Just I feel like this concept of exercise, there's so many thoughts and feelings behind it, especially when we're working in the eating disorder world. So yeah, I'll just kind of put that big question out there.
Yeah,
Yeah.
that is a big question.
Yeah.
Well, we have the professional organization of the dance movement therapists is the American Dance Therapy Association, and we have a definition, right, which is, I'm going to read it to you.
Yes, please.
Psychotherapeutic use of dance movement, body awareness, and embodied communication
Mm-hmm.
to foster healing and wellness for individuals, families, and communities. Right? So that's
Mm-hmm.
kind of the standard definition. So that being said, I will say that there is a lot of misunderstandings about what it is.
Yeah.
I think that when you say that in your mind's eye, people might be saying dance class or
Yeah.
Right.
aerobics,
Yeah.
or
Hmm.
sometimes people think it's going to be physical therapy.
Yeah.
Um, so it's really the focus is on emotional awareness and expression, right? So it's kind
Mm-hmm.
of a matter of where the focus is with that. And going back to this, what you were saying about exercise is that, movement is a huge umbrella.
Yeah. Yeah.
Word movement means so many things. Like
Yeah.
it can even just mean the way we breathe.
Yeah.
Mm.
Yeah.
Hmm.
Certainly.
can be
Yeah.
that nuanced. And then
Hmm.
exercise is really just one little silo under that umbrella.
Hmm.
And I think of exercise as being this intention to get stronger in some way. So
Hmm.
maybe we want to build muscle, or maybe we want to increase our ability to have stamina when we, do certain activities. And there's a gamut, right? All the way from elite athletes down to just, folks who want to build bone density, right?
Yeah.
So movement means a lot to us. And sometimes people kind of get stuck on that word dance. Um, but I want to emphasize that really we're talking about this whole umbrella, all the ways that we move. And I know we're probably going to talk about this later, but that really comes into play when we start talking about doing it at the residential level of care, which is,
Yeah.
the world that I live in.
Yeah.
Well, I was going to say to that, so you said like movement means a lot, right? I would say that to the providers, but then also for the clients that come in, the word movement can mean, so I mean, there can be so many connotations attached to that.
Mm-hmm.
Um, so it sounds like it would be really cool actually to be able to offer this at a residential level where there may be some really strong, like fearful, I would say, attachments to the word movement.
Mm-hmm. Mm-hmm.
Or this like attachment to like I have to keep doing this. I have to do this so much,
Yeah,
Right.
like a compulsion
Yeah, like
almost.
the
Yeah.
compulsion. Yeah.
Yeah, yeah, for sure. And I think that that's, the word dance also can be like that,
Yeah.
right?
Yeah.
Yeah. Yeah.
Yeah.
Because it's what I look like. And
Yeah.
and so
Yeah.
that's, really where we're kind of pivoting, right? Is that it's not at all what we look like. It's more about what we feel like, right? Kind
Yeah.
of that sensing from the inside versus this performative thing where we're having to do it for other people. Um, and it's tricky at the residential level of care, right? Because of that, what you were talking about, that compulsion, and sometimes people that are here are like really movement restricted. And
Yeah.
so it's both, you know, exciting
Hmm.
and challenging to
Hmm.
talk about that here, because there is um, a lot of feelings about movement
Yeah.
and dance and bodies and the mix for sure. Yeah.
Yeah. Yeah. Emotionally charged words, definitely in the eating
Yes.
disorder realm. So, how exactly can dance movement therapy help someone with an eating disorder? There might be people listening. They're like, what does our body have to do with our emotions? What does the body have to do with eating disorders, moving the body?
Yeah. It's all the same stuff. It's all about avoidance, and it's all about approach. And, on some level, can we even go beyond approach into curiosity?
Mm,
Uh,
Yeah.
mhm.
so it's just about bringing the body into the mix, right? We
Yeah.
spend a lot of time talking about our thoughts and our feelings and we talk about sensations a lot from a talk point of view, right? But dance movement therapy is where we actually go there and spend time in our body. I mean, how do you start talking about embodiment until you're actually like spending some time there with your body?
Hmm.
Right, right.
Yeah. So that's what's a little bit different about it, is that it's really experiential, and through movement, we're talking about a lot of the same ideas, right? And so,
Hmm.
yeah, but there's some unique things about it too. We're using space. We're not going to sit down necessarily. I mean,
Yeah.
we will sit down if that's kind of what's called for in the moment, but we can use the space. We can use the idea of time. So, how long does it take to do that movement, or do we do that movement quick? And what is that quality, and how does that relate to what we're thinking and feeling? Um, we use a lot of like moving together. So, um, when someone is engaged in a movement, we might reflect that. So that sense of togetherness is a nonverbal activity as well.
Hmm.
We use rhythm, right? This idea that that can be organizing and regulating, and can just help us feel grounded. A lot
Mm-hmm.
of research about the value of rhythm, which is something that comes into movement, also through the music sometimes that we use. Um, we use a lot of active imagination. And so when we're moving, right, we're thinking about what's going on here, right? Because there's something happening. There's something salient happening going on in our thoughts or our memories or the images or, whatever's bubbling up. Um, we use a lot of kind of really bringing the authentic self into relationship, right? Which is something that's really lovely to do non-verbally, right? So we're just here together as ourselves. So we have some kind of unique healing processes that we get to use because we're not sitting down and we're really paying attention to the signals that we're feeling in our own bodies and what's reflecting off of ourselves, right? Yeah.
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 Is that concept embodiment? Is that what you would describe as embodiment?
Yes.
Okay.
Yes,
Yeah.
that's another huge, another big umbrella, right? Yeah.
Another big umbrella.
Yes.
I'm just curious how, so like we can explain these concepts, but I'm thinking about somebody that has been just so disconnected for whatever reason. Like, w- yeah, like this sounds like it could be very big for them to just even just sit in this space, like you said, just sit in this space with the other people. What when you're trying to teach someone what it's like to be in their body, to just kind of exist, like what are some of the, I guess the barriers of like what do they have to overcome in order to kind of like get into that space where they can open up and like be available to what you're teaching, if that makes sense.
Yeah, so we're going to meet them where they're at, right?
Yeah.
They, we're going to start very small and very slow. And part of the thing about dance movement therapy is that we're watching for what the read is on the body, and we're using that information that we're sensing to check out what's going on. So it can be
Hmm.
um, very interactive. And this idea that we want to find that place of comfort first.
Hmm.
So for a lot of people with eating disorders, they're very comfortable being in their heads, right? So maybe that's
Mm.
where we're going to start. Maybe we're going to start with words.
Okay.
Maybe they're more comfortable in one part of the room.
Yeah.
Um, so really finding out what the comfort level is different with individuals and groups, right? And then, asking them, it's a lot like exposure therapy, right? In what way can you stretch a little bit, put yourself into a little bit of discomfort? Do we need to come back for comfort, right? And can we kind of do that in small growing ways over time? Can we spend more and more time with our body? Or maybe we can just like kind of notice a little bit what it feels like to be in our neck or our
Yeah.
fingers, right?
Yeah.
Kind of working from
Mhm.
the outside in. Uh,
Yeah.
and there's a lot of like, don't do anything that doesn't feel right to you, right? And permission to adapt, right? If the group
Hmm.
is doing something that they don't want to do or they don't feel comfortable doing, there's always this implicit permission that they can wait it out or they can
Yeah.
adapt. That right? Yeah.
Mm-hmm. So that really encourages them to get in touch with their own needs
Yeah.
every moment of the
Mm.
group. And what I'm hearing is that these groups, dance movement therapy, a lot of it is about improving your awareness of what's happening in your body every given moment.
Yeah.
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 Mm.
And people might be thinking, what does that have to do with eating disorders? And what I would say to that is connecting with your body is a huge part of the work because we're asking our clients to start checking in with their hunger cues, their fullness cues, what's happening in their body emotionally. Are there any signs that they're feeling something
Hmm.
emotionally? What is their body telling them in that moment? And
Hmm.
so dance movement therapy sounds like a way to really practice getting in touch with what your body is telling you.
Yeah. So that's well said. I like to think of it sometimes as a dynamic 3-point check.
Oh, can you
What am
say
I
more?
sensing in
Yeah.
my body now? What am I sensing in my body
Yeah.
now? What am I sensing and if I do that enough that I create a new habit, then I can become embodied. I can live in my body.
Hmm.
Right. And so for people listening, they're like, what's a 3-point check? So we do this thing at Renfrew where it's a way to organize what you're feeling. It's your thoughts, your sensations, and then your urges and your behaviors. So those are the
Hmm.
three points. And when you go into a dance movement group, it's all about getting in touch with the sensations, what's happening in the body.
Yes. And we like to think of it as bottom up processing.
Mm-hmm.
So we're not going to, remember what happened, just before lunch
Yeah.
and try to remember what we were thinking, right? We're moving our body, and as we're doing that, there are things that are happening in my subconscious that are going to bubble up, right? So that kind of awareness. So the
Mm-hmm.
sensation awareness, but also the awareness of what's happening as I move is the salient work is going to show up, right? Kind of in a bottom
Hmm.
up way. Yeah.
Mm-hmm.
Hmm.
Yeah.
Right, right. So I'm also curious about body image and how dance movement therapy might help people who are really struggling with body dissatisfaction or really struggling with, you know, just really intense body image
Yeah.
issues, even body image distortion. How might dance movement therapy help with that?
Yeah. I, I, that idea of a body image is something that it's really hard for me to get my head wrapped around because to me, that's such a cognitive process, right?
Mm-hmm.
Like
Oh,
I'm
yeah.
walking through the world in this constant
Yeah.
objective projection of what I look like, right? It's like a
Yeah.
triangle, right? You're never really just focusing on what it feels like, right? So in
Yeah.
a way, I want to say, forget about body image, right? And just live in your body, right? Like just be there.
Just be there.
Just be there.
What a concept.
I know, but
Wow.
it's really hard, isn't
I
it? Like,
know. I know. Yeah.
It is hard. It's such a shift, but that is such a good point that body image is cognitive, meaning a lot of it are just the stories we tell ourselves and the
Right.
comparisons we make in our head all the time.
Right.
yeah, what
Yes.
I'm seeing and what I'm taking in from the inside is not the same as what I'm sensing,
What I'm
right?
sensing.
And
Right.
and I know we have a big definition of body image, but I feel like the words still matter. This idea of image is like
Yep.
it's like a snapshot in time, right?
Yeah.
Mm-hmm.
Very two-dimensional. And we're not like that. We have volume, right? And we can move in three dimensions, right? And so I like this idea of embodiment as an alternative to that concept because it's so different, right? I'm not a picture. I'm not a reflection in the mirror. I'm so much more than that.
Yes.
Ooh,
I love that. We have
powerful.
volume. That feels so good to me.
Yes.
Yeah,
Yeah.
yeah, yeah. It's interesting too because it shows up in groups
Hmm.
that there's this kind of predisposition to move in this really like XY space.
Hmm.
Right. And the idea that you might approach someone in the Z
Mm-hmm.
dimension, right? It just like we have to kind of work towards that. What does it feel like to move towards something or away from something, right? That we have
Hmm.
this third space available to us. Yeah.
Hmm.
And the idea of using space and taking up space can be really
Hmm.
hard in eating disorder recovery because a lot of times there is sort of this belief at the root of the eating disorder that I have to stay small in this world. I have to stay small and I can't take up space and I need to be quiet and I can't use my
Hmm.
voice. And dance movement therapy is a chance to really literally expand your body and take up that space in the room.
Yeah. And it's interesting to me too, because that's like a flip, right? Like we
Yeah.
think of those as being, metaphors that we imprint onto the body, but in a lot of ways, it's really the other way around, right? It's this idea that taking up space is a body word, and the metaphor is actually in the thinking process, if that makes sense. Same thing with the gut reaction.
Yeah.
That's a body phenomenon, right?
Hmm.
Not, and we think of
Hmm.
it as a metaphor for the body, but it's the other way around, right? Starts with
You
the
know,
body. Yeah.
Yeah.
there's Sarah, are you familiar with who Amy Cuddy is and the power poses? Have you heard of them? Right.
I haven't heard the name, but I know about power poses.
Okay,
Yeah.
yeah. So Amy Cuddy was one of the researchers that really dug into power poses and gave a TED talk about it, and specifically talked about how people would change their body, and then how that the changing of their body, the way they positioned it to be either like open and powerful or closed in and small, how that literally had a direct effect on how they interviewed at different jobs. And so like giving folks the experience to expand and feel what it's like to be in their body. I mean, like that just, it's like that can give them so much, you
Yeah.
know?
Yeah. Yeah. I don't know if you guys, I know you know the name, the woman who wrote The Wisdom of the Body. She has a new book at Hillary, name escaping
Oh,
me.
okay.
It might come up later, but she's just written a new workbook, and there's a page in the workbook about that. Like if you
Okay.
feel creatively stuck, can you wiggle around? And will
Yeah.
that help, right? Um,
Yeah.
yeah, so that's one of those fundamental ideas around dance movement therapy, right? Is that you can use the body to shift the mood, and you can actually see the shift of mood on the body, right? We're one unit.
Hmm.
Those things
Mm.
all, right, happen
It's
together.
it's all connected. Yeah. So the book is The Wisdom of Your Body, Hillary McBride.
Yes, thank you.
Yes.
Yes.
Hmm.
Thanks for that resource. Yeah, we teach all the time at Renfrew. I mean, the three component model is one of the first tools we give. And
Yeah.
part of teaching that is that all of this stuff is connected. Your thoughts are connected to your sensations, and your sensations are connected to your urges, and your thoughts are connected to your urges. And it just goes on and on. And to have a group like dance movement therapy where you can really test that out, to really experiment what happens to my thoughts when I change what I do with my body? What happens to my urges when I change
Yeah.
what I do with my body? I mean,
Yeah.
what an amazing way to experiment with
Hmm.
how those things are connected.
Yeah.
Hmm.
And this idea of alternate action is a
Hmm.
beautiful fit with dance movement therapy, right? Can you
Mm,
actually imagine yourself doing something different? And then can you play around with what it looks like to actually do it in time and space? Yeah. Yeah.
very cool.
Yeah.
So at Renfrew, at the residential level, you run movement groups. Would you be able to walk us through how you might lead a typical movement group? I
Yeah.
I would love to hear more about this.
Yeah, for sure. So one of the things that's really unique about what I do here is that the groups are not sequential. So
Okay.
every group is a new group of people. Some of them maybe have been in group before. Some of them have never experienced it before. And so everything is a little bit like starting over. So I'm really turning it on before they even walk in the room. Like, am I in my body? Because I want my body to demonstrate what it looks like to be in it.
Hmm.
um, and then, as they walk in the room, I'm already thinking, doing some assessment work around, what might be happening for this person, what might be happening for that person. If I see somebody that's been in the group before that kind of knows the deal, I'm like making a mental note that person might be a helpful role model during the group.
Mm.
So they come in, and so I already know what's in the mix because I've got that turned on. We have a words for that. We call that attunement. I'm sure that's a
Hmm.
word that gets used in a lot of approaches. Um, and this idea of somatic countertransference, right, is that I'm reading that with my body. Um,
Okay. So you're in touch with your own body because that's giving you information about what someone else might be feeling in their body.
I mean, I'm sure that we're all doing that. All clinicians are doing that all the time, right? Kind of checking in on this intuitive level. But
Mm.
for us, we have a vocabulary, right, and training for how to work with that.
Mm.
But they come in the room, and a lot of times they'll sit on the floor. We don't have chairs. This is the movement room here. We don't really have chairs, but we have chairs for people if they want it. I'm telling them, make yourself comfortable. It's already starting, right? Like, what do you need? What is your body telling you? How do you want to um, address that?
Mm, hmm.
And so, we have pillows, we have blankets. Are you cold? Are you too hot? What can I do to adjust the temperature? We're already working on that sense of comfort and acknowledging the signals that our bodies are telling us.
Yeah, that
Yeah.
awareness.
Hmm.
Yeah,
Yeah.
yeah. And then I'll, give a kind of a brief introduction about what we're going to do, just to dispel some of the fears that we're not going to be doing aerobics, right? We're not going to be doing physical therapy, that something different is going to go on. And that I really am trying to tell them right there that we're going to co-create something, that this is not me in charge. This is all of us are going to make something totally unique together, right? And I don't know what's going to show up. We're just going to go with it. So we'll start with a gesture. A lot of times I like to say for really early groups, I'll just say, offer a gesture of hello.
Mm-hmm.
I'll get something pretty traditional, a hello, or even a hello, right? All kinds of different things. And then sometimes I'll throw something really weird in, like, hello, right? To give them a
And
little permission, right?
you're just like,
Yeah.
so just for our listeners,
Yeah.
you're like shrugging your shoulders as a hello, like something that someone probably wouldn't usually do. But
Mm-hmm.
let's go with
Yeah,
it. Yeah. Yeah.
yeah. So it's okay to be creative. It's okay to be expressive, right? There's no, we're not going to put a lot of like limits to that kind of work.
Mm-hmm.
Right.
Um, and then we'll do a little warm up, and I'll start it off. I'm usually doing a lot of talking in the beginning, because that's what people are comfortable with, is the
Yeah.
talking. And then we'll warm up, we'll kind of like attend to what our body needs to warm up. Um, I'll ask for, where do you feel like you need that right now? Maybe somebody wants to do a little side stretch, and letting that be okay as we transition into what we call the theme of the group.
Okay.
And that's that co-creating part, people will do something that's a little bit different maybe than the rest of us, and I'll pick up on that and we'll go with that for a while. And then there'll be something else across the room and we'll go with that. And sometimes I'll stop everybody and I'm like, what are you noticing? Or, what's showing up for you, or what's happening right now, to try to encourage them to really grab on to what that thought that's coming up, or that feeling that's in the room for them. And it's really interesting because that's where a lot of the symbolism will come in. Like, I'm thinking about a time that we all we made we were putting things into the middle, and it turned into like this sparkly pink slime. And we stirred it together, and then I asked them, what do you want to do with it? And they wanted to drink it, right? It was this like, we made this healing elixir, right? Which is this great
Mm-hmm.
opportunity to kind of like express those feelings of how hard it is to be in treatment, and what an instant fix might feel like.
Mm-hmm.
Um, and then we'll close it, we'll kind of come back together, have a little conversation, an opportunity to share anything that felt poignant or challenging. What questions might you be leaving here with? Um, and a gesture of goodbye.
Mm.
Mm.
Yeah. Yeah. And a lot of times too, at that point, I like to ask them, if you were going to name that group, like, by way of summary, what would you name that group? We've had like
Mm.
frogs under the sea,
I
yeah, all kinds of things. So
Yeah.
love
Yeah.
that.
yeah, yeah.
I love this so much. It sounds like something I would get involved in
Well,
I
every
know.
day.
It
Um,
sounds very soothing and
I
it
know it
just
does.
sounds safe, like
It
such a
yes,
sounds safe.
safe place to be when, especially when you have an eating disorder where it often feels so unsafe to be in your body, to
Yeah.
finally have a space where you feel like you can be together with people and just, there's no right or
And just
wrong. You can
be.
just be.
Yeah.
right or
Just
wrong.
move and be. Um,
Yeah.
so it does feel safe. And for those who may be intimidated by it,
Mm.
um, how do you start with them? How do you move with them? How do you support them? You know?
Yeah, I mean, again, it's patient led. It's what's your goal?
Okay.
And that idea that we can come back to a comfortable, that we can come back to a comfortable place.
Hmm.
Um, Watching and suggesting and checking in, what's, when I can see the discomfort, I can offer the
Yeah.
opportunity to come back into
Yeah.
something smaller, or maybe go to my toe, right? Because my toe feels, like a safe place for me to be right now. Whereas I don't want to talk about my heart right now. I want to
Okay.
talk about a
Mm.
different thing. Um, so, so yeah, and and really just focusing on strengths. What can you do? You know,
Mm-hmm.
what feels like approachable and comfortable and something that I can have some success at.
Mm-hmm.
Mm. It's reminding me of neurodivergent folks who often talk about how much they struggle with identifying what they're feeling in their body. It's like they might have a therapist who asks them, where do you feel that emotion in their body? And they're thinking, I have no idea.
Yeah.
So, yeah, I mean, how would you support a neurodivergent client who might come
Mm-hmm.
into the group thinking, I don't know why I'm here because I don't know what I'm feeling in my body at all?
Yeah.
Huh. Well, that is one of the challenging things around it is trying to put words onto feelings, right?
Mm,
And put
Yeah.
words onto sensations. So I just take the pressure off. I mean, one of the ideas in dance movement therapy is that you might not actually have to verbalize it, right?
Okay.
mm,
Maybe just having
Okay.
that experience is enough.
yeah.
I think, one of the beautiful things about it is that it does take some of the pressure off of having to put words around everything, right?
What
Mm-hmm.
a relief for so many people who might worry that there's some kind of expectation where they have to, verbalize what they're experiencing.
Yeah, they can just practice noticing, or you used the word getting curious earlier, and it probably does feel really good for you to say to them, it's okay, you don't have to put words to that. Just be curious about it, just notice
Yeah.
it.
I
Yeah.
think about a dance movement therapist that I know who worked with a gentleman on hospice, and they never said a word to each other. They just took walks together.
Mm,
Right?
Oh,
And that idea of just being together and how therapeutic it is just to be kind of met,
mm-hmm.
held, right? Without having to talk about it. I think so much about that here because we do 4 groups a day and they're all
Yeah.
talking groups.
Yeah.
And by the end of the day, right? Like maybe I need a break from talking. Maybe I need to do something where I don't talk, right? For a while.
yeah.
Yeah.
I mean, sometimes I'm thinking back to my own therapy where sometimes the most therapeutic moments is when your therapist just sits there with you
Mm-hmm.
and lets you just cry or feel or be. And those moments are so powerful. And I think sometimes we forget how therapeutic it can be just to exist in the same space with someone who is just holding that space for you.
Yeah.
Mm-hmm.
And we're really acknowledging what's happening in our body because really there's a lot going on in
Oh,
that
yeah.
moment. Right? There's all
Yeah.
kinds of things being traded in that moment, right? And it sounds, kind of hoo-hoo, but we know like all of these findings in neuroscience are kind of like slowly proving, right? The idea that we have mirror neurons, right? That we can sense each other's
Mm-hmm.
emotions without having to necessarily put words to it, right?
Mm-hmm.
Oh,
Uh, and
absolutely.
move our body in a certain way, and that helps us calm down.
Mm-hmm.
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 Yeah. So,
Yeah.
yeah, so
I
much going on, even in the quiet.
absolutely. I think, those things are starting to catch on a bit. I see a lot of things online on social media about, ways to regulate your nervous system. That's really a hot topic right now. And rhythm and movement and
Mm-hmm.
dance and all of these things are coping skills when we're feeling dysregulated. And I do think it's becoming a little more mainstream than maybe
Yeah.
when I grew up. That really wasn't something I was aware of as a child. I really didn't
Yeah.
realize how regulating movement can be to our nervous systems. But all of this is
Yeah.
backed by research, which is
Right.
so
Yeah.
cool.
I'm thinking about all of it as sensory, right? It's all kind
Mm,
of activating that lower brain that we have to turn on our parasympathetic system, right? It's all sensory. It's all body based. I mean, even the way that we see, the way we take information in through our vision, through our hearing, that's a body based, that's a sensorial process. So, yeah.
Mm-hmm.
So we talked about what a group might look like. I know sometimes you'll do individual work with people. So what does
Yeah.
dance movement therapy look like one-on-one?
Yeah.
Um, Yeah, I just had this beautiful session that I had the other day bubble up in my head, and I'm not sure how much I can like disclose about what happened, but um, they're coming in with their own agenda, right?
Mm-hmm.
And so they're wanting something. They come in wanting something, and so we really start there. And I think that just kind of like focuses the session more
Yeah.
on what I'm looking for and what kinds of things I might offer as alternatives. Um, Sometimes it looks like, well, a couple of examples maybe for our compulsive exercisers. Sometimes we'll divide the room in half. And this is what it feels like when we're doing that thing that we do, right? Faster, stronger, better, harder, longer, more, 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 more. And then this side of the room is, what does the opposite of that look like? Right?
Mm.
And so we just kind of like go back and forth between sides of the room, kind of identifying what our thoughts are saying, what we might be sensing in our body, what our urges feel like, right? So we could do something that's a little bit more of a bridge between like a talking and a moving. Um, and then, we might just put music on and just kind of play and have some fun
Mm.
and feel,
Hmm.
free and have a good time and laugh and play and right. So there's quite a range of what might show up, but it's always guided by, what they're needing or what they're asking for. Yeah.
I love that. It gives
Yeah.
so much voice and choice in the session, and that can be so empowering. I mean, to have a therapist ask you what are you needing and wanting out of this?
Yeah, for sure.
Yeah.
Yeah. Um, okay, Sarah. So thinking about eating disorders, thinking about Renfrew, and the work that you've done over the years, i- is there a particular eating disorder that dance movement therapy works best with, or a co-occurring disorder? We see a lot of anxiety,
Yeah.
depression, OCD here too. Um, or is there even like a better place in the treatment process
Yeah.
where we can
Mm.
incorporate dance movement therapy?
I'm biased. I think it belongs everywhere. I think it looks different at different places along the spectrum,
Okay,
right?
yeah, that's
And
good
what
to
it looks
hear.
like in the residential slice versus what it might look like, down the road could be
Yeah.
very, very different. When they're first here and we're working on motivation, like I feel like that's where we could be talking about comfort.
Mm, yeah,
And
Mm.
and it's kind of when there's a lot of malnourishment in the mix,
sure.
right? Then it looks a little bit different. It might just be sitting with like, maybe some self-compassion.
Oh,
Mm.
yeah.
Mhm.
And so, it starts to look a little bit different as, things progress. I have groups that I lead with our E-stage people, which are a little bit, I would say a little bit more about just tuning in.
And
And
E stage is the first of the
yes,
The
thank you.
stages. Yeah,
engaging stage, the
yeah.
engaging
Yes,
stage. So it's
so
the
used to
work
our
work
language.
yeah, so working on motivation, working on awareness, all of
Yeah.
those fundamental skills.
Early recovery. Yeah.
Yeah,
Yeah.
yeah.
And then, and then we go to A and T stage, which is acquiring and transforming. These are folks that have been here for a while. They kind of know this foundational set of skills and they're beginning to
Hmm.
like learn skills that take us into the discomfort a little bit more. Then
Mm-hmm.
what we start doing is we're doing a little bit more enacting of the skills. So
Yeah.
we're actually like taking this vocabulary that we've learned and playing with it a little bit and more structured kinds of activities. So we might walk an arc. You might actually walk through a behavior across the room. So if that's childhood and this is forever, right? Can you walk through that decision that you made? What
Oh,
Oh,
it looked like
wow.
before treatment and what is it going to look like after treatment, right? Can it
yeah.
kind
Oh,
of sense
wow.
yourself over time?
I didn't even
Um,
realize that was possible. So, our ARC, for folks out there listening, it's it's a tool that we use to help people become more aware of their patterns. And the
Hmm.
ARC stands for antecedents, so sort of like what triggered it on, then response, and then the C is for consequences. And oftentimes we'll have patients fill these arcs out so that they can really get to know themselves and really understand how their patterns play out and how those patterns get reinforced. And then in dance movement therapy, you actually have them act it out.
yeah.
Wow.
Or we might take the shape of an emotion that we would rather avoid.
Yes.
can
Mm.
kind of practice approaching it and moving away, right? We might really just kind of notice what's coming up. Trying to think of some of the other things. Yeah, but you get the gist. It's kind of how do we take these things and make them experiential to seal that,
Yeah.
I think, to really
Yeah.
put it in our bodies. Yeah.
Right,
This
right.
just feels so cool to me. It just makes me think like talk therapy is great, right? Talk therapy is awesome. And it is so cool when you can get in these spaces and like really allow your body to get in these spaces because so much of what we process, like you said, Sarah, is sensory. It's not just like we're not just in our heads all the time. Like our bodies are taking on energy and we're feeling things and hearing things. And it could be clothing, it could be the weather, it could be all sorts of stuff. So being able to like process our experience via like literally moving our bodies just sounds so cool. I
Yeah.
want
I mean,
everybody to do this.
as close as we can get to real time, right? Yeah. And we
Yeah.
love to work with talk therapists. In fact, I do a
Yeah.
lot of talk therapy myself, right? But it's a
Same.
good thing to put in the mix, right? Yeah.
Yeah. Yeah.
Absolutely. Absolutely. I would love to hear a little bit more about, I know we're running out of time. So I did have this one question about acceptance and commitment therapy because I know
Yes.
you're also a fan of that
Yes.
modality. And
Yes.
I was just wondering, how do you incorporate acceptance and commitment therapy into dance movement therapy?
Yeah. So for
Mm,
me, it's conceptual, right? Like ACT is about the idea that we have a self that's so much bigger than our thoughts and our desires and our even our body, right? That we have this kind of underlying, sense of who we are.
yeah.
Mm,
And to me, the body kind of meshes with that idea a little bit. And the other thing that I like about ACT is that we don't have to litigate our thoughts, right? They're
Mhm.
there. It's okay. We can let them go by. We can say thank you,
Mm,
brain, right? Because we're more than that.
yeah.
So it just
yeah.
conceptually, it's a good fit with bringing
Mm,
the body in. ACT does this physicalizing, has a physicalizing piece where you take emotional material and you externalize it as a way to kind of be
Mhm.
able to get curious about it a little bit differently. And so that's another good fit for me in terms of these two theories. And
yeah.
yeah.
There seems to be a lot of practice in dance movement therapy with noticing and accepting and just existing without judgment. And that is really such important work, especially early on in treatment and as you continue the journey.
Yeah.
So what a beautiful modality
Mm.
to practice those things.
I
Can
have to
I?
just slide in there one more thing.
Yeah.
That is that we have evidence that people have been dancing to express themselves, to
Mm,
celebrate the seasons, to process their emotions and loss for like 9,000 years. We have,
yeah. Yeah.
right? So we have
Yeah.
that.
Yes.
Yeah.
Yes,
Yeah.
exactly.
I was going to ask Sarah real quick because I know running out of time, but like, is there a cool success story or like what have you found to be rewarding in this work when you've seen somebody like lean into this, especially somebody
Yeah.
that was maybe intimidated or kind of nervous of getting in
Yeah.
touch with themselves?
You know what I love about it is the group synchrony. So I do this
Hmm.
Friday as my favorite group. We do a Friday afternoon group, and really the goal is just to release stress.
Yeah.
And there's a mix of folks. There's people that have come and it's their favorite group and they come every Friday. And then there's people who have never done it before. And so we just kind of like slowly build to this place where they're just having fun. They're just
Yeah.
Mm,
playing, they're being silly, judgment leaves the room. They're just having a good time. Sometimes we bring out scarves and we do, and it's just really lovely to watch them play, right? And to
mm,
go
Mm.
into
hmm.
that space of joy.
Hmm.
Yeah, so that's what's rewarding is to see the group really doing that together. It's just it's hard to put into words.
Yeah.
Yeah.
And what freedom that is that somebody can exist in play and not feel trapped, I would say, in the constant yucky thoughts that they may have
Mm,
otherwise experienced.
Yeah. You
Yeah.
just give them a little taste of what's possible, right?
Yeah.
right. What a break from the inner critic that
Mhm.
tortures them all day in eating disorder
Mhm.
recovery.
Mhm.
Sarah, what advice would you give someone who might be on the fence about trying dance movement therapy? What do you hope they hear from this episode?
Um, it's, we're whole beings, right? That,
Yes.
that there we there's that we're sometimes we can be scared or intimidated of what about what we might find in our bodies, but really that's where we find our sense of wholeness and who we are, right? Is to bring that with us.
Mm,
Um, and that, really develop trust in ourselves means, having trust in our bodies also.
mm.
Mhm. I love that. Sarah, thank you so much. This has been just so
Pleasure.
lovely to, yeah, to speak with you and learn a little bit more about dance movement therapy. And
Thanks for having
um,
me.
absolutely. And we want to say thank you to our listeners as well. Thank you for being here with us and learning with us today. We appreciate it.